All right, let's get started. Welcome, everyone. Thank you so much for joining us for today's webinar. We're going to be covering this topic. The title of today's discussion is the Nursing Shortage Solutions. So this is Hutchinson Regional's Innovative Programs. My name is Iman Abu Zaid. I'm an MD by background. I've been in healthcare technology for the last 10 years of my career. And I'm the CEO and co-founder of Incredible Health, which is the fastest growing career marketplace for permanent healthcare workers. Incredible Health is the only platform that allows hospitals to hire permanent nurses and experienced nurses in 20 days or less. We flip the script where hospitals and health systems apply to nurses instead of the other way around. So joining us today is Jonna Jenkins. Jonna is the Chief Nursing Officer at Hutchinson Regional Healthcare System. Hutchinson Regional Medical Center is a 190-bed, locally owned community hospital that services Reno County and their surrounding communities in Kansas. The Hutchinson Regional Medical Center was originally formed by the merger of Grace Hospital and St. Elizabeth's Hospital in 1970. The merger was actually one of the first of its kind in the nation at the time. The hospital has received 6 Gold Seal of Approval accreditations from the Joint Commissions. Before joining Hutchinson, Jonna was the interim chief nursing officer at Ascension Seton Medical Center in Austin, Texas. We're thrilled to have you today, Jonna. Thank you so much for joining us.
Thank you, and I'm happy to be here. And I'll just start off by saying Happy Nurses Week and Happy Hospital Week to everybody who's joining.
Yep, Happy Nurses Week. Awesome. So just a reminder to the audience, this is designed to be an interactive discussion. Please feel free to ask questions in the chat and we'll answer them as we go along. We've also set aside time at the end to do Q&A and answer questions as well. And then this entire webinar is being recorded. And so it will be a member of the Incredible Health team will be in touch with you afterwards with the recording too. All right, so today we're going to be covering a few topics. First is just the state of the nurse labor market, just so we're all, we set the agenda. We all are working from the same information about what's happening in the nurse labor market. We're going to be covering innovative hiring strategies that Jonna's team uses. We're going to be covering the topic of nurse retention, preceptorship strategies, how Incredible Health can help, as well as Q&A. All right, let's start with the market overview. So, we're all, operating in the U.S. healthcare system. I know many of the attendees on the call are nursing leaders, HR leaders, operations leaders at hospitals. So our demand for healthcare as a country continues to grow because our population is aging. That is putting more and more demand on the U.S. healthcare system. And we as a country have not done the greatest job of increasing the number of healthcare workers that's needed for that growing demand. As of 2018, healthcare became the #1 employment sector in the US. 1 in 8 Americans works in healthcare, but we have a massive shortage of healthcare labor. And probably the biggest shortages within that category is nurses. And so we are on track to be 1.1 million nurses short by the end of this year. The annual turnover right now for acute care nurses is at 19%. There are parts of this country where it is above 25% as well. And so we're seeing unprecedented amount of turnover. We're also seeing labor costs increase. So labor is a percentage of revenue just for publicly traded hospitals. It's at 48%. For nonprofit hospitals, it's even higher. And we're not only seeing increases in labor costs from temporary labor, but even the permanent labor is getting more expensive and increasing because of the shortage. And then the average days to fill or time to hire a permanent specialized nurse in the US today is at 89 days. Guessing these metrics resonate with you, Jonna?
Oh, yes, they do. It's been a tough time for hiring recently.
Yeah, absolutely. The one other piece of data that I wanted to make sure we share is what's going on with nurses. Why is it that they're leaving jobs? Why is the turnover high, and what are the top reasons for why they're leaving jobs? So we all know that nurses have gone through quite a challenging time over the last few years with the pandemic. But even despite the burnout and the stress of the job, we collect the reasons why nurses are leaving their jobs. Over 700,000 nurses use the Incredible Health platform. So we have 1 in 4 nurses in the US using Incredible Health to manage their careers. And we ask them when they're creating their profiles, and asking to be, added to the hiring marketplace, why is it that you're looking to leave? The number one reason it's selected is usually they're looking to advance their careers. That could mean moving into leadership. It could mean expanding their skills in their current specialty. That could mean cross-training to a new specialty. That could be a new graduate nurse looking to advance further. It can be a range of things. The second is the desire for a more flexible schedule. The days of 3 days a week, 12-hour shifts, full-time only are over. And, we have nurses that really have a lot of preference for a whole range of options when it comes to schedules. The third most common reason is something to do with geography. They want to reduce their commute time, or they're trying to relocate. And then the fourth is looking for higher compensation. All right, so with that in mind, let me just pause my screen share. I wanted to kind of turn over to Jonna next. I guess, Jonna, from the very beginning, what were some of the challenges that you're facing regarding nursing today, just at a high level? And are they different in Kansas, in where you are currently in Kansas, compared to when you were in Austin?
Yeah, I would definitely say they are a little different here than they were in Austin. Austin is one of those destination cities. People want to live there. I think it's still currently have over 100 people a day move into Austin. So people want to be in Austin. It makes the recruiting there a little easier. I'm in a city of about 60,000, so it's a much smaller area. We're about an hour from Wichita. So there is a larger city that's pretty close by. So that, that pulls a lot of the younger people, new grads, they want to go live in the city. So it does make things a little more difficult here. There's a lot of really great things about living in a smaller community. I moved from Austin about a year ago. I moved in July, and my commute time went from around 2.5 hours every day to I am currently 8 minutes from the hospital. So now my round trip commute is 16 minutes a day. So there are some definite advantages to being here, but the biggest challenges I think continue to be around just finding people who are ready to come and commit and work in a hospital. A lot of nurses left at the beginning of the pandemic. Trying to get some of those nurses to come back into the hospital is challenging. And then getting new grads who want to come and work in a setting that's more challenging than a lot of areas in nursing.
Okay. And then can you walk us through some of the strategies you're using to tackle these challenges?
So I think for us, the biggest thing has been really working to develop relationships with the local colleges and universities. When I got here, I was shocked to find that this hospital did not have a good, solid working relationship with the community college that's here in town. And we have a nursing program at that community college. So one of the first things that I did was make a connection with the director of the nursing program at Hutchinson Community College. I have worked diligently over the last 9 months that I've been here to really build that relationship. So we went from 4 semesters in a row not having a substantial amount of HCC nursing students in our building. In January, we had a welcome to Hutch, let's get you oriented to the hospital day with those students. And we had 120 nursing students in our building. So I would say the biggest thing that I've done is really work to reach out to those programs. I sit on the advisory board for both the associate degree nursing program and the licensed practical nurse program for the community college. I also now sit on the advisory board for Heston University, which is another local university. That's the first time that anyone from Hutch has been invited to be on that advisory board. And then, so through these growing relationships with the universities, I actually had another technical college reach out to me to see if they could start doing clinicals with us in the fall. So Salina Tech is about an hour from here, but had heard about how successful the clinicals were going for students who were here this last semester in the spring. And so now we have another school that's reaching out to do clinicals here, which is it's great to see young, fresh faces in the hallway and have their energy to feed off of has been really great for our staff also.
Okay. And then my understanding is that you also work with the chamber. Is that right?
Yeah, so the board chamber here in Hutchinson, not just with the hospital, but with a lot of our local businesses, really wanted to work on bringing some diversity to Central Kansas. There's not a ton of diversity here. So we reached out to a historically Black college, a university in Oklahoma, and we actually made the trip to Oklahoma. It was a group of business leaders, including myself. We went to the university. We met with students to talk about the opportunities that we have in Hutchinson for those people who are graduating from a degree program. So it was a really great opportunity for us to go out and reach to a different type of community, because we have never gone to Oklahoma from Kansas, which is kind of crazy to me that that's never happened. But we then have invited those students to come back. The chamber does what they call the backstage pass. That is where members from the chamber will actually tour people through Hutchinson. So Hutchinson is a small community, but we have a ton of stuff to offer. We have an excellent city park that is just incredible. So they'll take a drive through the city park. They'll see where our very minor league baseball team plays over the summer. Hutchinson is also really well known for the murals that are painted on a lot of our buildings. So if you drive on Main Street, you'll see this incredible, it's called the Rainbow Lion, and it's on one of our buildings. It's this beautiful mural. But then if you just go back roads a little bit or drive through the alleys, there are murals on a lot of the buildings here. So they'll take you on the mural tour. So this is a really friendly community for artists. They'll take you to Dillon Nature Center, and that's a beautiful area that was donated to the city, and it's just incredible with walking trails. They also will do what they call the real estate tour, which is sharing with people who are interested in coming here what real estate is available, what school district you would be falling in if you are in different parts of town, but really showing what you can get in Central Kansas versus what you can get in a lot of other places. So it's been really, that I think is one of those things that really just showing people what we have to offer in Hutch is really great.
Okay, and then it was multiple industries that went, not just, hospital or.
It was multiple industries. So we have what's called Dillon's. That's a branch of Kroger's. They were there. Our school district was there. We had multiple different types of industry that went to Langston University with us, and then in the fall we're going to have those students here. So hosting those students so that they can see what opportunities lie. And the thought that we all had as a community was that, you might not get one person who wants to move here right out of college, but if you get a group of friends and they all come here and they're like, oh yeah, this would be a great place for us to start our careers, not necessarily all in the same career. So we're really excited to see where that leads us.
Okay, great. Honestly, first, we've been building incredible health for over 5 years now. This is the first time I hear this idea, so that's great. I hope it works.
Yeah. I do too. I hope it works not just for the healthcare industry, but for the whole town. Like to bring in some fresh faces, freshly out of school, to really join the community, I think is a great opportunity for us.
Fantastic. And then any other, I guess, when you're thinking about nurse hiring, are there any other sort of different or innovative approaches that you're trying?
So we've put together kind of a talent acquisition plan to get us through the next year. So tonight, for example, we're having a nursing social. It is Nurses Week, so this is really to celebrate nurses. We have a couple of breweries in town. So we're going to be at one of our local breweries we'll give a ticket to every nurse that shows up. They'll get a free drink, and then, we'll share with them about Hutch Regional and how great it is to work for us. But this is really just an opportunity to celebrate nurses. And I think that often nurses don't feel like they're really celebrated for their profession. So this is our opportunity to just do that. We're also doing our own scholarships. So we have created scholarships for our local universities, paying for either the final year of nursing school or both years in the ADN program, all 4 years in BSN programs, utilizing that as a pipeline to get nurses. We don't need nurses just today. We're going to need them in the future also. So all of our scholarships come with an agreement for employment. So next Thursday, we're having our first signing day. This is the first time that we're actually doing these scholarships. So we're having our 9 scholarship recipients come in, and we're going to do a signing day, much like athletes do when they're signing to go to college. We're doing a signing day for them to come to Hutch Regional. So, and having that knowledge that we've got people in the pipeline who are already guaranteed employment here it's been inspirational to our team. They realize, oh, we can get nurses who want to come work here, who are willing to say, I'll work there for the next 3 years. It's a great place to work. So we've got trucker caps for signing day. It's going to be a really fun event, but also I think it's the future of nursing for us, is not just we're going to hire any nurse. We're going to hire the best nurses. We want them to have, a GPA that is remarkable, and we want to hire the best folks here. So the scholarships is a really fun thing that we started. It's been a lot of work to get that put together in a short period of time, but I think we're going to have a lot of success there. Another thing that we're doing is called our Boomerang campaign. Excuse me. So we did have quite a few nurses who left at the beginning of COVID and then through COVID. And we're just taking the time for the CNO to make a personal phone call to them and invite them to come back to work for us. Okay. We're not just offering full-time hours, we're offering what is it that they can work. So if you only want to do 6-hour shifts and we can find somebody else who wants to do a 6-hour shift, we'll partner you two together. And you each work your 6-hour shift to cover a shift in the hospital. We've actually had, I think we've made about 25 phone calls, and we've had 4 who've agreed to come back to us already. So for us, the advantage is they know our hospital, they know our system, they're ready to come and work. And all it really took was the time to make a personal phone call and ask them to come back. We also have a traveler conversion program that we just implemented. So if a traveler will agree to stay with us permanent, we're offering them a 1-year contract and giving them a $20,000 sign-on bonus. We're hoping to have 11 of our travelers who will convert. We currently have 7 that have agreed. But if we get the full 11, it's $220,000 that we're putting out into those sign-on bonuses or retention bonuses, but we're saving $1.2 million by not having them working for us as travelers. So, so far that has been a really successful event for us. And we have just started our multi-channel digital marketing campaign. So historically, Hutch Regional has not really been in the digital market. They haven't been doing a lot of advertising for jobs in that manner. So we just started that. It just launched last week. So we're excited to see what that does for us also.
Okay, that's awesome. Let me just quickly summarize some of the ideas. You mentioned the nursing social scholarships that are tied with employment agreements. Again, it's the first time I hear about the idea of the signing day. I love the idea of treating nurses like athletes. Yeah. That's super fun. Third, you mentioned the boomerang campaign. I mean, that's pretty phenomenal. 25 calls, which probably took, I don't know, maybe maximum a couple hours, right?
Yeah.
It took a few hours and you got 4 back. I mean, that's a very, very strong hit rate. Like 16% basically came back, which is awesome. And then the traveler conversion program. Would you be able to share with us a little bit more detail about your student loan repayment program?
So for our current staff, any staff that work for us, we are going to implement a student loan repayment program. Again, that's going to be tied with employment based on the amount of the loan. But we will be working directly with the lender and making those student loan payments for as long as they continue employment with us. So that's for all of our current nurses. We're offering that as a retention. We're also using that as a recruitment for our very hard to fill positions. And for us, those hard to fill positions are our med surg areas. Those acute care areas have continued to be the most difficult to fill. We don't have challenges really in our OR or L&D, ICU, ED. People want to go into those areas, but that acute care area has been our challenge. So our new hires who come into that area are also going to be eligible for that student loan repayment. And the repayment is up to $22,500 is what we will repay. If you hit that max amount, that's a 3-year commitment to work for the organization. So again, we're just trying to look for additional ways to not just recruit, but really show our nurses how much we appreciate them. I know from friends that I have that still work at the bedside, there's a lot of angst about all the money that gets put into recruitment when we've got these really great nurses. And so what are we doing to retain them? So that's a big part of our retention program.
Okay. And is it working? Do you have results on the program? Like, is it working?
It's just started. So we don't know if it's
Okay,
working yet. I believe that I mean, when I made the announcement to our nursing team, they were super excited. There's a lot of, and it's a relief. Like, student loans are a big burden. So just having that thought, especially for our nurses who are really committed to being here. We do tuition reimbursement, but not every nurse wants to go back to school and get a higher degree. So just paying off their student loans has been really, really well received. So I believe it's going to be very effective for us from a retention standpoint.
Okay, fantastic. There was one question that already came in through Michael Curata. Is this the question is actually, is this a union-free setting?
Yes, it is union-free setting.
Okay.
We do not have unions.
Yeah.
There is a hospital in Wichita that recently just went union. It's one of the bigger national hospitals that did, but we do not have a union here.
Okay. So one of the questions that's an inevitable follow-up, right, is like, look, these are phenomenal programs and amazing ideas. How did you and your team and your leadership team think about funding these programs?
So first I sat with my CHRO. We sat and talked. I had a lot of ideas. He was very receptive to the ideas. So then we really started putting the price tag to these things. Like, what do we think the total price tag will be? So for this program, there's a few other things that we've added. For our retention, we added what we're calling the personal choice account for our licensed personnel. This will be for RNs, RTs, and LPNs. We'll expand it out for other licensed personnel, but this is offering them up to $500 a year for continuing education. So we've done that. We've also increased our employee referral bonuses, changed our sign-on bonuses a little bit. So our total all in through 2024 is 846,000 plus a little bit of change. So once we got to the number, I presented to the board of trustees for the hospital that this is what we would like to do. They gave a full confidence vote and approved that dollar amount. However, the hospital is hurting for any amount of money, and we don't want to spend money if we can avoid it. So our hospital has a foundation that helps with a lot of different things. So I'm presenting in front of the foundation board this month, and I'll be asking them to fund some of the larger things, including the scholarships, the continuing education. We increased our stipend for that, and the student loan payoff. So I'm going to be asking them if they would pick up that portion. I have talked with our foundation director, and she feels really confident that they'll probably pick up everything, but we are asking for those specific things to start with. So I feel like having that foundation is a great way for us to spend some dollars that, as a hospital, as an organization, we haven't been operating in the black. So having a foundation that's willing to support us is really helpful.
Okay, got it. So there's many leaders on the call who need different programs funded, right? So I'm wondering if you can just walk through a specific example of, whether you're asking of it from the board, it could be the CFO, it could be the foundation. Like, how do you think about putting together a business case for one of these programs?
So, I think the easiest one to put together the business case for was the traveler conversion.
Yeah.
And I think from a board perspective, it for them was almost the hardest to swallow. They, at one point this year, we figured that we were going to actually spend $18 million in RN travelers, which is a ton of money when you're a community hospital and not a huge hospital. Yeah. So for them, over and over, the ask was, how do we get rid of travelers? And then I was going and saying, no, we want to keep the travelers, not all of them, but we want to keep some of these travelers. They're really great nurses. So for that one, it actually turned out to not be that difficult. I'm like, yes, we're offering them $20,000 as an agreement to stay for a year, but if all 11 agree to that, it's only $220,000 versus the 1.2 million we'd be putting into having 11 travelers. So that one was fairly easy once they saw the numbers. Yeah. And then I think it was really about putting the numbers together in a way that made sense for them, helping them to understand that, yes, this is a large dollar amount that we're asking for, and we recognize that. But for the average nurse, turnover is, that cost is somewhere between $50,000 and $70,000. So when you put that in, before I got here, the hospital was at a 37% turnover rate for nurses. So when you figure the amount of nurses that we lost, that just the turnover, this is not hiring, travelers to replace them, just that turnover was going to be well over $1.5 million. So I think it was helping them to understand that it's not like putting an ad in the newspaper and you have 20 people apply. Nurses have a degree, it takes time. Once you get them, they can't just start working on the floor. You have to orient them, you have to teach them your system. And if they're new grads, you have to have people standing beside them to help them so that they can develop critical thinking skills. It's not as easy as just offering them a paycheck. So I just don't know that they had heard it before in such a way as like, do you understand how much turnover costs versus let's put some money into our team and we'll get the return on investment that way.
Okay. Phenomenal example. And the onus is usually on the CNO to put the math together, right? In collaboration with the HR leaders or the finance leaders and so on. But we can never assume that that everyone understands the math. Right?
No, and honestly, when I started speaking with the board, I was shocked that they did not understand, that they just didn't have any idea about turnover and the cost of turnover and training nurses. And they just, these are lay people from our community who support this hospital. So it took some time to get them to understand what it is we do.
Okay, great. You mentioned new grads a moment ago. How do you think about hiring new graduate nurses, and do you sort of balance it with the number of experienced nurses that you have?
So I think one thing that I have learned over the last 3 years is that new grads really, we've got to hire them, and it's on us to provide them an appropriate orientation and get them up to speed. While we don't have as many experienced nurses as we used to have. So now we have to be really innovative in the way that we have our new grads precepted. So when I got here, it was still very much in the old school belief of you need to have your most experienced nurses doing the entire orientation. And I really said, we absolutely can't do that. We're burning them out. They're going to refuse to be preceptors, or they're going to leave. So we have to figure out a new way to do this. So for our orientation, for the first several weeks, when the new grads get here and they really are just completely overwhelmed with this new job, we put them with someone with 1 year to 18 months experience. What we want them to learn is learn the computer system, learn how to document. We want them to start to understand some of the time management, but we also want them to see, you feel like this is so overwhelming now, but look at what you're going to look like in a year. In a year, you're going to be able to help. Also, those nurses who are precepting for the first couple weeks, they're the closest to where that new grad is. They just experienced this. So it creates a relationship with someone who's very much on their level, someone that they can really connect with and share what they're feeling, because that person is not that far away from it. After we get them through that first couple of weeks, we have a couple of different things. We ask our educators to actually take a patient load and spend times on the units with our new grads. So clearly we don't have enough educators to go around, but that is a part of it. We usually have them with an educator for 3 shifts. So that's another week of their orientation. And it may be right after they're with a new grad or at some other point in the orientation. And then we go to our nurses who have a little bit more experience and really start to help develop that critical thinking skill. But also helping them to understand that we are a full team. So if the person you're with can't answer, there will be somebody else who can answer. And if there's no one else, call the house supervisor. They're always here to answer questions and to help you critically think through things. So that's kind of how we've done it, is we've tried to save our most experienced nurses for the end of the orientation, where the new nurses have a sense of how to use the systems, where things are. It's not that time consuming teaching them all of those things. They're left to really impart their knowledge and teach them how to think critically, so that when they are on their own, they'll have a better sense of, I can actually manage this.
Okay. So I wanted to go into the topic of nurse retention next. Let me just quickly share a little bit of data with the audience. So this is just a recent survey information that we have. It's less than a month old, from U.S. nurses. And so these are the main concerns that nurses have today. And it was a very large sample size, like hundreds of thousands were in it. And so the top reasons are here. So top concerns are staff shortages, personal burnout, salary and benefits, their work environment, scheduling issues, and limited career advancement, in this order. Now that was like a national survey. I know that every hospital and every health system is different. And so I would love to hear sort of how are you thinking about your nurse retention strategies? And well, I guess first, let's see if you could just share the challenges that you're seeing when it comes with nurse retention, and what are the strategies you put in place to address them.
So definitely, I think the number one reason is like, it's this concern of what's going to happen if 2 people call in on my shift. What's going to I mean, there's a lot of the what if fears, which I think is pretty common in healthcare, the what if fears, because a lot of healthcare is preparing for the what ifs. So I think one thing we've done here that's been really helpful is we have what we call a clinical staffing bonus program. What that is, it's offering an opportunity for nurses from other areas, say like our cath lab nurses or our OR nurses, anyone who wants to pick up additional shifts, so anything above their scheduled hours, they can sign a contract for 4 weeks or 8 weeks or however long they want to do it, and work in areas that might be a little bit less staffed. So we might have our cath lab nurses working on our acute care tele unit. And what that has done is really helped the nurses to feel much more like a team. So you don't have your specialty nurses who never see what's happening upstairs in the tower.
Mhm.
And then you have your nurses who do work in those areas, and they're also offered that opportunity to pick up extra shifts, but they can see other nurses from the facility coming to help. And it's showing that, we do care about you. We're willing to put in what it takes to get the help that you actually need. And the other nurses in the building care about what's happening. They want to help out also. So it's helping to build that real feeling of, I feel like here we're more of a family than just coworkers, and it's helping to build that feeling like we care. The leadership cares enough to put some dollars into it, but your coworkers also care enough to come and work an extra shift to help y'all out while we're really working to build a pipeline of new nurses. So.
Okay. And then we'd love to share if you could share a little bit about your compensation philosophy and how you think about nurse compensation.
So compensation, I think for everyone has been a huge topic, and I think it's a real concern for a lot of nurses. So we're actually in the process right now of having our compensation reevaluated again. So in December, we did an additional $2 an hour raise. We wanted to make sure that we're staying up with the market. That was for all nurses. But we're doing a deep dive into compensation, not just locally, but regionally, to make sure that we are staying competitive. For us, we want to be competitive, but we also want to build a culture that shows that we appreciate the nurses who work with us. So historically, one of the issues in nursing pay has been you hire a new nurse and they might get the 4% raise at a year because, everyone's getting a 4% raise, and then they might get another 2% raise the next year. And suddenly you have new grads who are making more than people with experience. So one program that we put into place here was that annually on your hire date, we look at compensation to make sure that we don't have nurses who have 5 years of experience now making less than our new grads, because we're constantly updating what we pay new grads to stay competitive. But now we're really looking at all of our nursing team really frequently to make sure that we are not falling behind. And not just in our local area. We feel like it's really important for us to look at the regional area and how we fit in there. So I think that we've been very proactive with our compensation package and continue to be very proactive, looking at making sure that we're staying up with market.
Great. And then we mentioned a couple of times flexible scheduling. And you mentioned that as even a tactic to bring in your boomerang strategy, right? To allow whatever shift preferences they want. How do you think about flexible scheduling? We understand that it is more difficult, honestly, for nursing leaders to manage a whole range of scheduling options, but it's clear in our data, also in your information, that it is what nurses want. So how do you think about flexible scheduling?
So we've done a couple of things, like offering split shifts. If you find someone, now we can't have you come and work a 6-hour shift, because then at the end of your 6-hour shift, we've got other people who are picking up all your patients. So we do, if you want to do split shifts, we ask that you find a partner to do those split shifts. We have looked into 10-hour shifts and 8-hour shifts in a lot of different areas. Another thing that we're doing is we do self-scheduling. So we have a minimum requirement for weekends, but we do self-scheduling and try to make sure that we're accommodating everyone's request. But we also have, while we have still lots of full-time positions, we have started hiring a lot more part-time and PRN people because they don't want to necessarily be locked into 3/12s a week. And then we've started offering time for, I'm willing to come in and work for 4 hours today, and we're utilizing that so that our people who are working can get lunch. Come in for 4 hours. We'll take you for 4 hours. We'll have you cover people so that the rest of your coworkers can actually have a lunch, which is, it's a lot when you're in the hospital. You don't often get lunch. So making sure that we're doing that. And so we are offering a whole variety of shifts and never saying no. When someone comes to us and says, this is what I have to offer you, we don't say no. We say, okay, let's see how we can fit this in. And I think that's really important for us to look at the staff nurses and let them know we want to work with you. We understand the work that you do is stressful and it's trying, and you can't offer us 12 hours every day. So let's see how we can utilize you, maybe in a different unit. Maybe we can have you work in the inpatient rehab unit, just passing meds for a couple of hours. If you can do that, that would help us out. So we're really just trying to say yes as much as we can. And when people have creative ideas around scheduling, we're like, oh my gosh, that's great. Thank you for bringing it to us. The split schedule came to us from a nurse who said, I am willing to work 6-hour shifts, and I have a friend who is willing to work the other 6. Could we do that? And we were like, yes, you can. We're happy to have that. So I think it's really about learning how to say yes and not just thinking about those blocked 36-hour weeks. You have to be really open to what people are willing to do.
Yeah, absolutely. And do you believe it plays a big role in your bringing down your turnover too?
I do think that being more flexible in our scheduling has helped us to reduce our turnover over the last 9 months. Like really trying hard to get everyone to get to yes rather than jumping to no has been a positive change. And I think that our team feels that they recognize that we will do anything we can to help in any situation. And I think it's also helped when the nurses and really all the staff see leaders really trying to get to yes, they're more willing to help each other out also. So they're like, oh, you need to take 4 hours off because you've got a dance recital to go to. I'm happy to come in and I'll work the last 4 hours of your shift for you. So that has been really helpful.
All right, fantastic. You mentioned when you joined, the turnover was at 37%. Has it gotten better since then over the last few months?
It has gotten better. I actually met with our HR guy. We are currently at 23%. Okay. And really feel like as through the next 6 months, we're going to get down into the teens again, which is, I want us to get to 10%. That's my end goal. I think we're probably 2 years from that, but I think we're going to get into the teens and stay there as we really work to recruit and change the culture within the organization. So.
Okay, well, fantastic. Congratulations. That's already a huge improvement. It's fantastic. Yeah. All right, so next, what we'll do is just share a little bit more information about Incredible Health, and then there have actually been many questions submitted for you, Jonna. So we'll spend the rest of the time on Q&A. I think people are very much resonating with what you're saying, and have follow-up questions. All right. One other thing I wanted to just mention, Jonna, before I get started with talking about Incredible Health, I always ask the question at the very end, or what are your top 3 tips for nursing leaders when it comes to the topic of nurse hiring and retention? And yeah, we'll let you have a think about that, so we can ask that at the end. Okay. So Incredible Health, we are a software company headquartered in San Francisco. We operate nationally. Hospitals and health systems, they use our custom matching technology to hire high quality permanent nurses in less than 20 days. We're used by over 700 hospitals and health systems across the country, including very large systems like HCA and Tenet and Kaiser Permanente. We work with large regional systems too, like Wellstar and Baylor Scott & White, lots of community hospitals as well, and many academic medical centers, including Johns Hopkins, Stanford, USC, and others. As far as what we do, there's a few unique things about our software and our marketplace. First, the employers apply to the nurses instead of the other way around. As you can imagine, the nurses absolutely love that, right? Because they create a profile, they sit back and relax. They get interview requests from different employers, and the nurse gets to decide which interviews to accept and which ones to decline. So this is a very nurse-centric or candidate-centric platform. We also have automated the screening of the talent. So they are pre-screened before they're put in front of employers. We also use matching algorithms to ensure that the right nurses are showing up in front of the right employers and vice versa. So it's a more customized or personalized experience. And then we have a robust set of data analytics. A two-sided marketplace like ours that's enabled by software churns out an enormous amount of data. We shared a little bit of that at the beginning of the webinar in terms of just why nurses are leaving. But also, you know, nursing and hospital leaders use our data to benchmark themselves against other hospitals and health systems on speed in the hiring process, on how well nurses are converting from one step to the next, on a whole range of metrics as well. So for nurses, you know, the way we attract them to the platform is that we just offer them lots and lots of free services and tools. We offer free continuing education for every single nurse in the country, accredited in all 50 states. We have free salary estimators. Nurses that sign up on our platform have access to free career coaching, and they get assigned a talent advocate who's also a nurse who works for Incredible Health. We offer, there's an exclusive community for nurses where they can ask each other for advice in both our iOS app and our Android app. And, you know, lots of other career resources as well. And everything about Incredible Health is free for nurses, including using the hiring marketplace. We are only used for permanent workers. This is definitely not the platform for temporary workers or travel nurses. We are exclusively only working with permanent nurses. Just want to share a little bit more data to the audience in case it helps you continue to think about your nurse hiring strategy and your retention strategies. So first, 68% of nurses accept the very first offer they receive on our platform. 61% of nurses accept the very first offer, even if the second or third offer has higher compensation. And so that really just speaks to the need for having very, very strong hiring operations and ensuring that it is a experience that's fast and easy and efficient for nurses, because this is a highly competitive environment when it comes to hiring nurses, and every single market, no exception, is highly competitive for hiring nursing talent. This is just a quick case study for a team that we support in the LA area. And so for this team, without Incredible Health, their days to fill was at 66 days. With Incredible Health, they got it down to 19 days. These are the different steps in the hiring process. We had the biggest impact on the time to source. It went down from 44 days down to 3 days. And then we also removed days in other steps of the process through things like automating phone screen scheduling and automating hiring manager interview scheduling, because we don't want scheduling to become a bottleneck at all. And so this ultimately, we're trying to reduce the days to fill by hiring permanent nurses faster. The hospital and health system is able to reduce the number of travelers that they have, which results in at least $2 million saved for each hospital and health system, each hospital location that we work with. We also track retention on our platform. So at the 1-year mark, the retention rate for nurses hired through Incredible Health is usually about 15% higher than the hospital's baseline. The reason for that is because the nurse was able to consider multiple opportunities before selecting a hospital. So it was a very well thought out job search, as opposed to just taking the first thing they could get. This is essentially how we work with hospitals at a high level. These are the 8 steps in the hiring process. Everybody roughly has the same 8 steps. It's a true partnership with an established talent acquisition team at the hospital. We are doing the heavy lifting in the first 4 steps. So we're sourcing, pre-screening, confirming the nurses actively looking, getting that first phone screen scheduled. At that point, the talent acquisition team that is already working at the hospital takes over. They complete the phone screens, get hiring manager interviews accepted, get offers out and accepted. So this is a true partnership. We often talk about how nurses need to operate at the top of their license. We also need our nurse recruiters to operate at the top of their skill set. And the top of their skill set is engaging with talent, speaking with talent, building those relationships, and building relationships with hiring managers. A lot of the administrative work can be automated, like sourcing, for example, and confirming they're actively looking and pre-screening, things like that can be automated in software like Incredible Health. All right, let's go into the Q&A. I know Danny on our team has shared a link. If you want to find out more about Incredible Health, you're more than welcome to click on that link and sign up for a quick consultation. All right, so Grace Ortiz asks, I think this question is for you, Jonna. Her organization has also partnered with local nursing schools to, for the same reasons, to drive up nurse hiring. They also provided 3 of their staff to be clinical instructors in exchange. Just curious if you've thought about ideas like that too in your relationship with your nursing schools.
Yes, we actually have 2 of our nurses are working as adjunct faculty at the community college that they both started in the spring semester. So it seems to be working well. I am really pushing for us to have additional adjunct faculty. One of the things that I think would be very helpful, it's difficult when we have a lot of students here Monday through Friday, just during the day. So we're really hoping that through the utilization of adjunct faculty, we'll be able to get nursing students here for our evening shifts and also on the weekends. So I'm working with the director of the nursing program as we try to get additional adjunct faculty to see how we can get the students in some of the more off hours so that they get a better feel also for this is what nursing is. You don't always work Monday through Friday. You do work on the weekends and you do work in the evening. So we have done that. We're just in the beginning phases of it.
Okay, great. This is a question or thought from Lisa. Have you tried or considered a 9-hour shift, which allows for some overflow during high volume needs? 4 days, so essentially 4 days a week, but 9 hours.
We haven't tried that, but I love that idea. I'm hoping that once we get to a position where we're fully staffed, that we will start bringing in for all of our inpatient units, a discharge nurse. So someone who can take over the discharge so that our staff can take care of the patients that are going to continue to be here. We'll have someone who can give a quality discharge because that's the only thing they're focused on. So that'll be our next step once we're fully staffed within. And that will be probably something more like a 9 or 10-hour shift. We wouldn't have them coming in until probably 9 in the morning and then working until whatever time we're really done with our discharges. But I love the idea of 9-hour shifts. I'm certainly super open to anything that will work. If it will work, we will try it for sure.
Great. The next question is just about back to the new graduate topic. You mentioned earlier about the importance of hands-on training, of needing to pair them with an experienced nurse, needing to orient them. How do you think about preceptors and educators? I think the person who submitted the question is, I think all of us, right, struggle with educators and preceptors and ensuring they're not overwhelmed or even ensuring that we have enough. How do you think about that topic of preceptors and educators?
So one of the things is making sure that our preceptors feel really recognized. And I mean, I worked as a preceptor and I remember leaving after a shift and like not having a voice because I talked so much. So I can vividly recall the extra work that being a preceptor is. So I think first just acknowledging that we understand that it's extra work. The second piece is trying to cut down on, for our most experienced nurses, the amount of time that they're spending at the beginning of orientation with the new nurses. A lot of that stuff, the very first couple weeks up to a month, can be done by a less experienced nurse, which is giving our more experienced nurses a break. No one can precept every day of their career. They have to have a break. And so really figuring out how to give them a break and then how to really truly recognize what they're doing. It's not just about giving them a differential when they're working. It's about true recognition of without them, we can't keep the hospital going. So I think some of it is just really that taking the extra time to really recognize what they're doing.
Great. And I guess our final question is what are your top 3 tips for the leaders on the call for when it comes to the topic of nurse hiring and retention?
So for me, I'm glad you gave me the time to think about it. The first one is find a way to say yes. This is something I think has been a challenge at every position in my career. from the time that I became a manager and first started hiring nurses, I was sometimes challenged to say yes. And then I was like, okay, I've got to hire. How do I get to yes in hiring people? Because when I first started as a manager, I was like, I only want full-time people, 36 hours or nothing. And then I realized, okay, I'm going to have to change that. But certainly in my time in leadership, things have changed drastically. So I think find a way to say yes. And that's not just in hiring, that's part of how you retain, is find a way to say yes. And then I think don't fall in the trap of we need nurses. We just need a nurse. I don't think anyone ever needs a nurse. You don't want a nurse who doesn't want to be in the unit that you're hiring for, in the position that you're hiring for. You have to accept the best. So if you interview 5 people and you don't think any of them are the best, don't hire those 5 people. Hire who you do believe will be the best, because those are the ones that are going to stick with you. So I have worked with people and had to coach some leaders, and you can't just hire because you need somebody to work these shifts. I think you accept the best. Think about who you want to work for you and hire that person, but don't just hire anybody. And then growth opportunities. I think when you're hiring, even before you're hiring, when you're screening, you should be informing every candidate of the growth opportunities within your organization. I think for nurses in particular, we are learning people and we want to continue to learn and we want to grow. So you should start a hire anytime you're interviewing, letting them know what the growth opportunities are within your organization. I think every organization has growth opportunities and they might look different based on the area you're hiring for, but always start with some growth opportunities. Let them understand that you may be hiring them into this position, but they have potential to continue to grow working for your organization.
I mean, those are fantastic. The growth opportunities one is particularly pertinent, because one of the top reasons why nurses are leaving their job is because they believe they don't have career advancement opportunities in their current role, with their current employer, and usually that's not true, right? Usually
it's almost always not true. And honestly, we should always be succession planning. I am already working on grooming the next CNO for this organization, and we all should be doing that. I mean, your charge nurses should be trying to groom the next charge nurse, and so on and so forth. You should always be really offering growth opportunities for everyone.
All right, so we know we're all operating in a difficult market, but healthcare has always been very dynamic. But at the end of the day, I mean, I think I have a lot of hope, right? Because there's a lot of new strategies and tactics that are coming out right now and that are being implemented to support the nursing workforce. And so the future is definitely bright. And just thank you so much, Jonna, for sharing your ideas and your strategies and your thoughts on this challenging topic.
Well, thank you so much for having me. I agree it's a challenging topic, but I think the future is really bright. I think we have an opportunity now to change the way we hire and to change the way we retain. So
absolutely.
Thank you.
Thank you. Just a reminder to everyone, we did record the webinar, so a member of our team will be in touch with the recording. You're welcome to send us, if there are questions you have even after the webinar that you want to ask, please feel free to email us at questions@incrediblehealth.com. And Danny also shared the link if you wanted to sign up for a consultation with us. Thank you so much for your time today, Jonna. We really appreciate you.
Thank you. Y'all have a good afternoon.
All right, you too. Bye.